This is Jonathan Fite, and I am co-founder and chief executive here at Beyond Lucid Technologies. I'm very pleased to be able to give you a tour and quick training to use the MEDIVIEW BEACON Prehospital Health Information Exchange. The first time we put together a video like this, it was to demonstrate an industry-leading approach to letting hospitals and public health services run real-time analytics on inbound patient care records from any mobile medical, that is, fire or EMS service in their region, as long as that service was using a NEMSIS-compliant patient care record system. In the intervening time, some other systems have emerged, and it's now important for us to distinguish them from the MEDIVIEW BEACON Prehospital HIE, which was the first to showcase real-time EHR consumable handoff of patient data to a hospital or other care facility. By the way, when I refer to hospitals in this video, I'm using a shorthand for any care facility or other entity that can be legally granted access to mobile medical data with the appropriate authorization. This can include clinics, nursing homes, rehabilitation facilities, doctors' offices, even non-clinical partners like coroners and public health agencies. So that we're clear, whereas the Health Data Exchange from ESO Solutions requires a custom implementation of data points based on the preferences of the receiving facility, as ESO puts it in its published documentation, this model results in a one-off interface every time it's deployed. Our approach is not customized by facility. Instead, we use the standards for interoperability laid out by the Federal Office of the National Coordinator in the Department of Health and Human Services, which oversees health information sharing at the national level, as compared with ImageTrend's Health Information Hub, which uses an intermediary to convert data from one format to another. Our company does the entire data conversion process ourselves. This means there is no chance of any friction between your partner technology company and their partner technology company. In the case of Beyond Lucid Technologies, it's all one and the same, and we are grateful to the California Healthcare Foundation for funding this innovation a lifetime ago, back in 2015. The last thing I'll say on this topic is that for users of our MEDIVIEW ePCR system, the entire process of sharing information with a receiving facility is 100% free. For users of other ePCR systems, the price is a simple flat per record rate that is intended to cost less than the cost of sending, printing, receiving, and managing faxes that are sent between a mobile medical agency, like an ambulance or fire service, and the receiving hospital. Contact us for more information on the per record cost, but enough about that. Upon logging into the MEDIVIEW BEACON Prehospital Health Information Exchange, the process for using the system is intended to be extremely simple to hospitals and public health agencies. Every facility to which one of our partners transports patients, which therefore has a need to receive inbound data, can get a login to the MEDIVIEW BEACON Prehospital HIE entirely for free. There is no cost to access the system. The cost to use it is based entirely on the number of charts that pass through the system. And again, if your partner is using one of our charting systems, there is no cost at all. Upon logging in, you'll see two tabs. The first is the Incoming Records tab. As you might expect, this is where a facility that is receiving patients from the field will see charts belonging to those patients that are en route to it. To be clear, the data that show on this tab are relevant to the receiver of the patient. For users of the MEDIVIEW ePCR, the screens will look similar to what you would see coming in from a dispatch system or CAD. However, the dispatch call section of the ePCR includes details like the chief complaint, the scene location, and the time allotted to submit the report. None of that is directly relevant to the receiving facility, which needs to know when the crew left the scene or when the patient was referred to the facility for care if he or she is not being transported by ambulance. The facility receiving the patient needs to know the clinician's primary impression and other demographic details like age and gender that may have been collected from the scene or while en route. They might need to know if there is an associated alert from a system like Pulsera. an advanced planning document or end-of-life medical order, such as a POLST, or if key details about the patient should be reviewed, even prior to arrival, in a database of pediatric special health needs and medical complexity. To view the content of the chart, including any integrated attachments, simply click the PDF button to see everything captured in the field up to the time of the click, including demographic and clinical details, incident-related information, medications administered, procedures performed, EKGs imported, images captured, including identity cards that can be used to validate the patient in the receiving hospital's electronic health record system. This is important. Another leading system in our industry asks crews to validate a patient's identity before scanning and sharing data into the hospital's health record system. We think that's risky because the crew may not have a way to know whether they spelled the person's name correctly, for example, or if there is a typo in the medical record number. We therefore think it's better to let the facility see the incoming data for itself in real time and determine that it's correct, so that it can not only queue up the bracelet or the face sheet if required, but also can rely on more than the practitioner's spelling or typing, which might understandably be wrong. For example, take my name. My name is spelled Jonathan with an O-N at the end. Thanks, Dad. If you spell it with an A-N, it turns out that there's a different Jonathan Fite living in Charlotte, North Carolina. I found this out during my online dating days. A story for another time, surely, but an important weed-out mechanism if you're trying to determine whether a potential significant other takes the time to diligently check spelling when Googling you. Just saying. But if I have a health issue while I'm visiting Charlotte, and if a crew member were to misspell my name, you'll find someone, just not me. And so one can imagine the potential risk that a human error goes sideways when it comes to importing and then binding that information to the electronic health record at a destination facility. Having the ability to take and transmit details like the picture of a driver's license or another ID card can make all the difference when someone has a common name or an unusual name, or if information was captured in a hurry and possibly not at all, depending on the patient's condition in the field. All of this information is accessible from the first of the two tabs in Beacon. Let's move over to the second tab now. This is where things get quite exciting when you consider the ability to not only look up any patient who's been transported by any ambulance or fire service that is using, again, any NEMSIS-compliant patient care record system in the field and has marked the particular facility as the destination for its patient. This is a huge and meaningful distinction, for it gives hospitals and public health services with access to Beacon a unique and secure way to track patients over time. For example, seeing how many times and by which transporting services a patient arrived at their facility. In other words, it becomes possible to immediately see who is moving around the region, getting transported by multiple services. You no longer lose track of anyone, and we refer to this as dropping a net over the region. It's particularly important in places like San Francisco or Boston, where a variety of mobile medical agencies intersect and care for patients around the area. And there are also social determinant challenges like substance use disorders or mental and behavioral health issues within the community. Today, the MEDIVIEW Beacon Prehospital Health Information Exchange offers a unique, real-time, at-a-glance view of whether a given patient has arrived at the care facility from more than one service. And we also give managers of multi-site care facilities or facilities that operate affiliated clinics or doctor's offices the ability to instantaneously see patients who are transported system-wide by multiple transporting services to multiple destinations, all on one screen. Providing a place for the receiving facility to see everyone who's coming into it, no matter the service, and to see those patients over time. Dropping a net over the region means no longer losing track of high-risk or chronic care patients as they seek care around the ecosystem. This also, of course, is highly facilitative to interventional programs and post-discharge follow-up in the vein of community paramedicine or mobile integrated health or any similarly named program. Also, receiving facilities utilizing the MEDIVIEW BEACON Prehospital Health Information Exchange gain the ability to access and analyze discrete data within each chart that is inbound to it, no matter the ePCR vendor. This includes the ability to look at the administration of medications like Narcan, or the performance of procedures like EKG monitoring or intubation. Records can be sorted by a range of sentinel markers, such as pediatrics and cardiac arrest, as well as by the disposition of the call, how the patient did, whether spontaneous circulation returned, and even where and when the call took place, for a deep dive analysis without having to do a single line of coding. Over 1 billion queries are possible through the MEDIVIEW BEACON Prehospital Health Information Exchange without any more knowledge of programming required than you might use to create a graph in Excel. Finally, and urgently in some communities, the MEDIVIEW BEACON Prehospital Health Information Exchange provides the ability to put data back into the chart, not only to return potentially missing information like outcomes, insurance, and demographics. We implemented a unique one-touch COVID-19 status confirmation button. Simply touch the line of the record for your patient, then touch the COVID-19 status button if the patient is found to be COVID-19 positive, to apply that indicator value to the chart. If you need to export or share this record, just click PDF to open the document as you saw before. Then you can print it if you really want to, but frankly, we hope you won't, or save the document as a PDF. And in an ideal world, you'll want to extract an EHR consumable continuity of care document that meets federal standards for interoperability. Even the most widely deployed electronic health record systems across our country can consume the data and extract discrete information, not just a PDF or a picture of the chart. In another video, we'll show care facilities how they can request transports or follow-up care on patients who might warrant a visit from a mobile medical provider in a non-hospital setting, and how mobile medical agencies can refer patients to other settings of care in a manner that complies not only with HIPAA and high tech, but also with SAMHSA, the Substance Abuse and Mental Health Services Administration's rules for protecting patient privacy and ensuring a revocable handoff to non-hospital care facilities. Another set of unique and exciting features built into the MEDIVIEW BEACON Prehospital Health Information Exchange from beyond Lucid Technologies.